In over 10 years of being a doctor, I've seen hundreds of patients in our clinic. And I've got a lot of questions over the years about chiropractic care. So I decided to create this video so you can understand some principles behind chiropractic care. You probably have some questions right now about chiropractic. I know that I did when I first started. My dad brought me when I was a teenager to the chiropractor, and I had a problem with my shoulder. I was a pitcher on the high school baseball team, and my shoulder never seemed to get any better. I went from doctor to doctor and doctor, and nothing ever seemed to help me with my shoulder. So my dad says, why don't you come with me to my chiropractor? He can look at your shoulder for you, Tim. And I said, you know what? I said, Dad, I know you and Grandpa go because your back hurts. Why would I go to the chiropractor? He says, just come. So I went, and after getting some care there and some adjustments to my neck and my shoulder, within a few weeks, I was back on the mound pitching pain-free. And that experience changed my life. And that's why today I'm a chiropractor. So what I want to share with you is what I learned through that process. And really what I believe is the four main principles when it comes to chiropractic care and spinal health. The first principle is this: as your body is amazing, and your body has an ability to heal itself. The second principle is this: is your central nervous system, your brain, spinal cord, and nerves controls all the health and healing inside of your body. The third principle is subluxation, when the spine is out of position, that causes nerve interference or blockage of nerves inside of your body. And the fourth principle is this: is that the chiropractic adjustment, it corrects the subluxation, removes the nerve interference, and lets your body heal itself the way it's designed. So let's start with this: the human body. God's finest creation that He ever made is your human body. And to show your body is really built or designed or created to heal, an example would be if I took a piece of paper and I was to give you a paper cut, across your arm, what happens to that cut eventually? It'll heal itself, right? I mean, your body knows how to heal itself. You don't need to think about that healing process. You don't need to take vitamins or pills. Your body knows how to heal that by itself. Because inside of us is an innate intelligence, an inborn wisdom that knows how to heal. That's your body's wisdom is unmatched as far as its ability to heal and capacity and adaptability. Innate intelligence. I mean, that intelligence is so amazing. I mean, for example, let's take your heart. The human heart beats 100,000 times every single day. And it pumps 6 quarts of blood through 96,000 miles of blood vessels. Your digestive system that works, that converts healthy food into bone and cell structure. That system is 28 feet in length, and it feeds the entire body. And what I found even most amazing is DNA. That DNA who makes up who we are. That genetic info inside of us is wound and it's so compactly wound in the double helix formation. If you took all the DNA of all of the 75 trillion cells that make up your body and put it all together, it's so condensed it would fit in the size of a box, the size of a large ice cube. But if we unwound that information and we attached it end to end, there's so much information in the DNA, it would actually reach from Earth, the sun, and then back to Earth 400 times. That's how amazing the body is in its ability to be capacity to heal. So the question then is what is health, right? I imagine if you're watching this video right now, you want to be healthier. So how do you know if you're healthy or not? Can you base your health solely on how you feel? I mean, can you feel fine right now, but can there be a problem inside of you starting to occur? For example, can you feel fine right now, and is there a possibility that maybe a cancer tumor is growing inside your stomach? Can you feel fine right now, and possibly your heart right now is starting to shut down? It can, right? And you can feel absolutely nothing. So we have to know you can't judge your health solely on how you feel. But when we have certain symptoms, we have to understand that symptoms are basically your body's intelligent response to a problem. I mean, thank God you have symptoms. And here's some examples. Here's some warning signs maybe, like a fever, is a fever, is that a good or a bad thing? Well, it's actually a good thing. As a fever is your body raising its temperature to fight off viruses and infections. Vomiting, for example. Now, is vomiting a good or a bad thing? Well, if you go into a restaurant and you got food poisoning from the food you ate, well, vomiting actually that is a good thing, isn't it? Because it's getting it out of your system. So, when it comes to your healing, then, to really understand what health is not simply feeling good. Remember, again, you can feel totally fine, but have a health problem starting to occur inside your body. Health is your body functioning and your body healing at 100%. That's the definition of health. So the question would be, is in what organ then, or what system inside of your body controls all health and healing? It's your nervous system. Your nervous system controls every system inside of the body. And it all starts right here in your brain. That's your brain is a control center. 25 billion of the most highly advanced cells are right coming from here in your brain. And your brain is like the hard drive on your computer. It's running everything else inside of your body. And because your brain sends signals right down your spinal cord over your nerves to all the organs inside of you. So that controls everything else. And to prove the principle, let's take an example. If I was to cut the nerve between your spinal cord and your heart, what happens to your heart? Well, it wouldn't work, would it? It would stop. What would happen to you? You would die from that. So it's because the nervous system controls that organ. It controls your digestion, for your heart to beat, for your lungs to breathe, for digestion to work, for you to hear this video right now, to listen to it. That's all because your brain, spinal cord, and nervous system is running that process. So the concern that we have as chiropractors is there interference? Is there a blockage of nerve signals inside of your body? That term is called subluxation, which is the bone out of position, putting pressure on nerves. That nerve interference is where the problem takes place. So if our brain and body are communicating through our nervous system without any kind of interference, then we are functioning at 100%. But if we have that subluxation, it blocks the brain-body communication. That interference then starts to cause what's called dysfunction inside of us. And every single day, subluxation is left in your nervous system. It causes more and more dysfunction inside your body, which eventually can lead to what we call disease, your body not healing properly. And often, we don't even know it's even happening inside of us when we have disease. Then what comes next then is after all the years and years of subluxation inside the body, causing a miscommunication between brain and body, now the organs are starting to become diseased, and then finally, years later, we then notice the symptoms. Remember something, symptoms are the last thing to appear. And once you have a symptom, you know you definitely have a problem then, right? It's your body's warning sign there's a problem in there. Like for most of us, when we have a symptom, what do? Well, we rush to the medicine cabinet and do what? We take medications just to block the symptoms. But is that really going and fixing the underlying cause of the problem? So there's a study done in the 1920s by Dr. Henry Windsor, a medical doctor. And he wanted to see, is there a correlation between the central nervous system and organs? So we figured the best place to start is why don't I look at some cadaver studies of people who died of organ disease. And let's trace that disease organ, let's trace the nerve from that disease organ back to the spine and look for some kind of misalignment in there. And what he did, when he did all these studies that he did, he found, in studying over 200 structures, and over 100 different organisms, he found that in the human things he did as far as cadaver study, he found almost 100% correlation between the diseased organ and the same vertebral level that nerve comes that controls the organ. For example, all 26 cases of people who died of lung disease that he studied, when he traced the nerve back to the spine, he found spinal misalignments in the upper thoracic spine. In all 20 cases of people who died of heart disease, he traced that nerve back, he found nerve blockage right there at T1 to T5 in the spine. Stomach disease, all 9 cases he found from T5 and 9 in the spine. Those nerves are being blocked when those nerves that go to the stomach. From liver to gallstone to pancreas to spleen, the kidney, uterus, prostate, bladder, the list goes on and on. Every single time when he found that the cause of the disease was going back to the spine, that interference shuts down the organs. So it's so important that we have proper spinal alignment. So the first thing, from the front, when you are lined up, you want your posture from the front, from top to bottom, to be straight from top to bottom going down. So you believe your nose above your lips, above your belt buckle going straight down. That's the straight view going this way. Now, but if I turn to the side, you want to have 3 curves in your spine like this, a curve in your neck, mid and lower back. And on this issue here, you want to make sure your ears are aligned above your shoulder, above your hips, above your knees, and above your toes. That's the side alignment. And now, in doing this now, for over 10 years of seeing patients, I'm finding that side alignment is our biggest problem. And of all the problems, the curve in the neck is the one that's the most important for us to check. Because all healing in your body from your brain must come through your neck to get anywhere else inside of your body. The neck curve is always most important for us to check. That's why they're now, in science and research, they're now calling the neck the arc of life, that curve in the neck, because it's that important. The problem that we find in patients often, if I was to demonstrate this, is what we call forward head posture, as the head starts creeping forward and going this direction. This is what we call this forward head posture. What was happening is that normal curve in your neck is now being straightened out. And then when it straightens out, it blocks the spinal cord and nerves. Inside your spinal cord, in that area, inside the spine, if you lose the curve and it goes straight, the cord inside there starts to thin out. Like taking a rubber band and pulling it, it actually thins and it weakens. So it damages your lifeline inside of your body when you lose that curve in your neck. When you have that forward head posture-like posture, it can add up to 30 pounds of abnormal leverage on your cervical spine. It's caused problems. It's also been proven that if you have the loss of curve in your neck, it causes heart issues, problems with digestion, problems as well with lung function. The most important thing is keeping that normal curve in your spine. So on this video here, if you watch this, this is showing what happens over years if you don't take care of your spine. So the first image you see here on the video is a normal arc and curve, the way it's supposed to be aligned. Now we'll watch it as the years progress, what happens to the spine if you lose the curve and what kind of degeneration takes place. Take note when you watch this video, if you look at the black spaces between the bones, the discs, how it becomes narrowed. And the bones actually start changing shape during the degeneration process. So if you watch it going through, you can see how the bone's changing shape, how we got movement happening throughout there. And then now we have what we call phase 2, phase 1 into phase 2 into phase 3, severe degeneration causing spinal issues. So let's figure something out then. Some of you maybe already saw your x-rays or want to get x-rays taken of your spine and are wondering what would cause this? What would cause this to occur? What causes that subluxation degeneration inside of you? Well, the first thing we're looking at is poor posture. And again, if I turn to the side, especially now, what we're finding for people is what we call forward head posture, and it's done mostly due to computer work. That most of the population these days work on computers like this, don't we? And we're bent over and typing like this, or we're driving in cars, or working over on counters doing work. This is one of the biggest causes of subluxation and loss in curve to your neck is computer work. That causes that forward head posture process to begin. Also, big things as well, any kinds of traumas, any kind of slips and falls. So any kind of past car accidents you've been in, when your neck's been whipped around. Even a small fender bender when your head barely even moves, that still causes the ligaments to shift and can cause spinal misalignment. Any kinds of falls you've had, sports injuries growing up, childhood falls. Because the important thing to understand is all these things are cumulative. That even now, if you're later in your years, that all the problems that even occurred when you were a child, as you get older, all these problems can stack on top of each other and causes further and further degeneration and decay in your spine. Research has now found, for example, for children, that the average child falls up to 3,000 times by age 6. So right there, would that cause some spinal problems? You better believe it. And one of the biggest things is actually due to the birth process. So we look at the birth process, childhood fall, again, right from the birth, the biggest spinal trauma you'll ever experience in your whole entire life happens at birth. From the day you're born, when the spine is turned and twisted and pulled, as the doctor is delivering you, that is the biggest spinal trauma you'll ever occur. And mostly it's the neck area, upper neck, that's the most interfered or pulled on or tugged during the birthing process. Even in a regular, normal vaginal childbirth, that the cervical spine of the baby is pulled to 3 times its length right from the start. And even in worst case scenarios, things like the forceps delivery or in a vacuum extraction delivery, those there, right there, like a forceps delivery or vacuum, is up to 40 to 70 pounds of pulling pressure, pulling on the infant or newborn spine right from the start. Will that cause some spinal problems? You better believe it. That's why we check so many children in our office from the day that they're born to keep their spine healthy right from the start. So what are some do's and don'ts? Along with your chiropractic care and getting adjustments, what else can you do to work on your spine? Well, the first thing is proper posture. So really being very aware of your posture. Like I mentioned before, standing as straight as you can from the front. So lining up your shoulders. Looking into a mirror is a good way to get this lined up. You look into a mirror, see how your posture looks from the front is a great way to do it. Again, if I turn to the side then next, your posture from the side like this, and you want ear aligned above shoulders, above hips, above knees, keeping your shoulders back, your head up high, tucking your stomach in. That's where you want to be. Most people, when they have problems over time, what we'll see is a posture, again, looking like this. So you want to keep the shoulders back again, head up high, stomach tucked in, keeping you lined up from the side the way you're supposed to. Lifting and carrying, a big thing is this. So when you lift and carry things, make sure you bend with your knees and you lift up. You want to bend and lift up. You don't want to just bend over and grab things. When you're at work, this is a really important thing to understand. If you're sitting at your work or your desk at work on a computer 8+ hours a day, 5 days a week, week after week, you want to make sure your office ergonomics is set up properly. A chair that supports your back well, but most importantly, where is that monitor height for you? That monitor height should be at eye level or above at all times to keep that normal curve. Most people that I take care of when I talk to them about ergonomics, they work on laptops that keeps your head low, or they work on monitors that are too low. That causes you to lose that curve in your neck and causes major issues in your spine over time. Sleeping position. Without a doubt, this is an important thing. You're going to spend probably 8 hours, hopefully every single night, somewhere around there, sleeping. So that position of your body when you sleep can affect your spinal alignment. I always say I recommend you sleeping on your back or on your side. Either one is fine. Definitely do not sleep on your stomach, because on your stomach, your head has to be turned, and it causes abnormal rotation on the spine all night long. In addition, when you're on your stomach, your lower back will hyperextend, put pressure on nerves. In addition to that as well, when you're on your stomach, you can't breathe properly and your diaphragm cannot distend the way it's supposed to. So for a number of reasons, do not sleep on your stomach. So on your back or your side are your best positions. What kind of pillow to use? Common question that I get. Really, when it comes to pillows, flatter the better. And again, if I turn to the side, I can show it to you. You want that pillow to be nice and flat so it drops your head back like this. If you have too much cushioning or pillow behind your head, it drives your head forward and again causes forward head posture. Spinal exercises that you can do is working on range of motion and flexibility that we offer here in the clinic for you. If you want to get a handout on that, you can. And then the last thing is a thing called a posture pulley, and that works on posture alignment and working things out. We sell them here at the clinic as far as getting your spine aligned properly to get you back up where you're supposed to be. And as far as the philosophy and where it all started, let me explain the power of chiropractic. Back in 1895, in Davenport, Iowa, a Dr. D.D. Palmer had started the profession of chiropractic. And it's really a great story because the first patient that he ever worked with was not somebody who had back pain or neck pain. It's someone who actually was deaf. His name was Harvey Lillard. Now, Harvey was a janitor there at Dr. Palmer's clinic. And Harvey had a problem in which he was deaf. And in his history, Harvey had explained that when at a certain time in his life he had bent over, felt a pop in his upper back and neck area, and from that point on he was deaf. So he went to Dr. Palmer and seeing if Dr. Palmer could help him. So Dr. Palmer decided then to do the very first chiropractic adjustment ever, adjusting the spine, putting the spine back in position for Dr. Harvey Lillard, taking pressure off the nerves, letting to see what would happen. The amazing thing, within 2 weeks, Harvey Lillard's, his hearing came back. And it was from adjusting the spine, his hearing came back. And the story goes, he got his adjustment after a few weeks of getting adjustments. He says, you know what? He says, doctor, I can hear the wagons on the street. I can hear the wagons on the street. His hearing came back from this. So again, right from the start, it was never solely designed, chiropractic wasn't, for just neck and back pain. And now the biggest key of why you want to get adjusted is one thing only, is it corrects the subluxation, it restores proper nerve flow, and it improves the healing power within your body. Some study has been done recently when it comes to, for example, a big problem now we have in America is blood pressure. It's been proven that chiropractic cuts blood pressure. In the Journal of Human Hypertension, a study was done at a hospital right here in Chicago, and they brought in a chiropractor to adjust patients who had high blood pressure. And they worked on just the top 2 bones in the spine only. And they found when they adjusted the people, after 8 weeks of care, it dropped the patient's blood pressure by 14 points on the top number and 8 points on the bottom number in just 8 weeks of chiropractic care. And the best part about that study is the fact that the doctor just made adjustments to the person who had the high blood pressure or hypertension, and their body innately then was able to heal and bring that blood pressure down. Because really, high blood pressure is not a disease. It's actually a symptom. Something caused that symptom, and if you have subluxation in the upper cervical spine, it can cause high blood pressure. The immune system. One of the biggest things patients always tell me, they're like, well, doctor, I've noticed the most amount of change with getting regular chiropractic care here in my immune system. Dr. Ronald Perot, a PhD, did a study. And he brought in a chiropractor, Dr. Joe Felicia, and he did a study trying to see if there's any kind of link between chiropractic care and its influence on the immune system. And so they took a study of people who have received chiropractic care for 5 years or more. So regular maintenance, consistent care for over 5 years. And he found that people who received regular chiropractic care had a 200% increased immune response than those who did not receive chiropractic care. How amazing is that? And a 400% increase in immune response with those who received care versus those people who had cancer and a lowered immune response. So one of the best things you can do for yourself is to receive regular chiropractic care to boost up your immune system. For my own personal testimonial, again, I've been in practice for over 10 years, and I get regular weekly chiropractic adjustments for myself all the time. And in over 10 years of being in practice, I've never, ever missed a day of work due to sickness. Because I know when my spine is maintained and adjusted, it keeps my immune system up. So that's the next important thing. Maybe you're already started with us under chiropractic care, or you want to get started under chiropractic care. Once you get started in the process, how often should you get adjusted over the long term? Well, it's the same thing as brushing your teeth, is it not? You wouldn't stop brushing your teeth at one time, would you? No, you keep doing that for regular dental hygiene. Same thing with your spine. You want to consistently maintain and get maintenance for your spine or spinal hygiene. We just do too many things, all of us, don't we? We bend the wrong way, we twist the wrong way, we sleep wrong one night or something else, and the spine starts to shift back out of position. So we all need regular spinal maintenance at some level. What we found through research over the last 15 to 20 years is that arthritic changes start to occur in your spine within 2 weeks of joint immobility. So Dr. Tapio Vidman, an MD, did a study on this, and he found just that. If you let your spine be immobilized for a 2-week period of time, the process of degeneration and decay starts to begin. So what I always tell all patients, the best thing I could tell you for regular maintenance care is do once a week adjustments. That's what I do for myself. That's what I do for my family, is that we do regular once a week or weekly adjustments to keep our spine healthy. But at least at minimum, you want to get adjusted every other week. So every 2 weeks, to at least maintain your spine so you don't start falling back and causing degeneration and decay or early arthritis to occur. So there's 3 things that we do to analyze how your spine is aligned. The first thing is posture. Like we mentioned a few times during this video, your posture is really important because posture is a window to the spine. So looking from the front, how's your alignment from that? From the side, do you have that forward head posture? Is your spine set too far forward? So the posture evaluation is extremely important for us as doctors to analyze and diagnose your problem. The second thing is we want a scan on computers through thermography. We call it a thermal scan. And that scan runs along the spine and can pinpoint where you have nerve blockage occurring. And those are the nerves which control your autonomic nervous system, or the nerves that control the organs inside of your body. So we can tell from that high-tech computerized scan where your nerves are blocked and how it's affecting organ function inside you. And the last test that we do is spinal x-rays. Spinal x-rays can help us see and actually visualize how your spine is aligned. Is there spinal misalignment? How long has it been there? Is it putting pressure on nerves? Where is degeneration beginning to take place in your spine? How healthy are the discs? Are all things we can answer by looking at the x-rays. And we do what's called full spine x-rays, so we can see the whole entire spine from top to bottom. I hope this video answered some of your questions about spinal health and chiropractic care. We look forward to helping you in our clinic and helping you achieve the best health you possibly can.